Hello, my name is Michaela,
And I'm Bruce.
and we are physical therapy students at Advent Health University, currently presenting at the Hope Clinic on the Synergy System wall mount exercise device. So this rehabilitation system covers everything you need to know for complete spinal exercise rehab, including cervical, lumbar, and core power exercises. So the system is indicated for patients dealing with neck pain, back pain, or for those who are just looking for a more general strengthening system. So Synergy systems can accommodate to small areas or rooms in a PT clinic.
The system is very versatile with the amount of possible exercises, and it is easy and efficient for patients to use in the clinic and immediately transfer it into a home exercise plan. The bands can be easily replaced or switched out of the system if any damage were to occur to them. The device is highly functional and useful for several injuries, including rotator cuff, scapulothoracic, or cervical injuries. The system aims to improve a patient's quality of life through enhancing muscular endurance and strength.
To use this system, the PT must figure out how to set up the Synergy system to complete whatever exercise you want your patient to do. Since the Synergy system is so versatile, you must figure out the most beneficial ways for your patient to use it. The resistance level of the Synergy system bands must also be determined. The therapist must also know how to add the ideal band to the system and remove it as well. Prior to the use of the Synergy system, the PT should ensure that the bands are still strong, taut, and in good condition. The setup should ensure that the ring and carabiner are firmly secured to the Synergy device. It is also important to consider the lifespan of any elastic resistance or TheraBand used in conjunction with the machine. Each TheraBand can typically withstand around 5,000 reps of stretching before snapping or breaking. Specific patient precautions prior to resistance exercise include individualizing the exercise program to fit their needs and diagnosis, as well as instructing the patient on proper form of the exercise and ensuring patient safety and compliance. So in this exercise, Bruce instructed the patient to do lateral hip walks out and back for 6 reps, making sure she kept the proper form. And then see, he safely removes it and places it on the cabinet after use. In this exercise, the PT will be setting up the patient for standing bilateral rows. So while using the Synergy system, if the patient has any underlying cardiovascular disease, be sure to monitor their vital signs before, after, and during the exercise. If the patient is experiencing any pain, make sure the pain isn't further exacerbated by the exercises, and then Bohr's scale of perceived exertion can also be used for the patients to rate the intensity level of each exercise.
I just instructed the patient on how to perform a core exercise using the Synergy system. Some safety considerations for using this device include using proper body mechanics, hand hygiene and ensuring cleanliness of the equipment, proper therapist and patient positioning for the exercise, monitoring the intensity of the exercise for the individual patient, having a level surface ground, and making sure there are no other patients near their patient who is using the Synergy system. Be sure to terminate the session if the patient requests to stop the exercise at any time, if the patient's vital signs become unstable, or if they experience any serious symptoms such as dizziness or lightheadedness. When performing the cervical rotation exercise demonstrated above, monitoring for these signs and symptoms is especially important during the sets, as well as spotting the patients when they are finished and assessing for signs of faintness after completion. When the patient completes an exercise, the therapist should assist the patient with removal of any equipment. It is important to wipe down the equipment before and after each patient uses it. Then return the bands into the cabinet when the exercises are finished. When documenting any exercises done using the Synergy system, be sure to include the positioning of the patient, the type of band used, the resistance of the band, cues that the patient needed, as well as the sets and repetitions done. This will make it easier for other PTs and PTAs to reproduce the exercises done with your patient. The Synergy system also can serve as a stable place to attach TheraBands for patient exercises. The high and low bars allow for a ton of versatility by allowing for upper extremity and lower extremity training, as well as targeting muscles from various positions and angles.
In this final exercise, we will be demonstrating the patient is working on shoulder external rotation while seated on a yoga ball. The PT makes sure to guard the patient as he sits onto the ball to ensure patient safety. This specific exercise would be implemented in a rotator cuff rehabilitation program. So overall, the Synergy system is an effective tool for helping patients with their healing process. The Synergy system offers the latest and most effective functional exercises and protocols available for patient care today. Exercises can retrain muscles to fire when appropriate and improve balance and stabilization.
Thank you for watching Michaela and I's video on the Synergy system. We hope you enjoyed.